Hello. A healthcare professional has recommended that you have a colonoscopy to look directly at your large bowel. In order for your colonoscopy to be successful, your bowel must be empty of feces or poo. Abnormal changes can sometimes be tiny, so even the smallest amount of leftover poo could hide something important. If the bowel is not empty, your colonoscopy may have to be cancelled and repeated at a later date. Therefore, it's very important that you follow the bowel preparation instructions and dietary advice shown in this video. If your procedure is booked with only a few days' notice, don't worry. Just begin to follow the instructions as soon as you can. There are some important things to consider in the days leading up to your procedure. If you take iron tablets, please stop taking them 5 days before your colonoscopy. If you take medications such as Imodium, codeine or Fibergel, please also stop taking these 5 days before. If you take blood-thinning medications such as warfarin, clopidogrel, dabigatran, rivaroxaban, edoxaban or apixaban, please contact the endoscopy department as soon as possible for further advice. If you're taking diabetic medication, you should receive additional information about this. Please contact the endoscopy department if you've not received any advice. Before your colonoscopy, you need to eat a low-fibre diet. Here are some things you can and cannot eat. For a whole week before, you should avoid nuts and seeds, watermelon, cucumber, grapes, melon, tomatoes and popcorn. For the 3 days before, you should avoid bulky, fibrous foods, for example, wholemeal bread and pasta, high-fibre white bread and cereals such as bran, muesli, oatmeal and Weetabix, as well as cakes and biscuits. You should avoid most fruits and potato skins, baked beans, Brussels sprouts, peas, broad beans and celery. This means that your diet should be very bland in the last few days before the colonoscopy. You can have well-cooked meat, boiled and mashed potatoes, plain white pasta and rice, plain yogurt, eggs and cheese. The time of your colonoscopy will determine when you need to stop eating before your colonoscopy. If your appointment is before 10 o'clock in the morning, you must not eat anything after 9 o'clock the previous morning. If your appointment is at or after 10 o'clock, you must not eat anything after 12 o'clock midday the previous day. You can have clear fluids such as water, squash, black tea and black coffee until 2 hours before the procedure. If you have any questions about eating, drinking and taking medications before your colonoscopy, please contact the endoscopy department.